Hello and welcome to 72 Dragons Health. Today we had the pleasure of speaking with Dr. Briana Jegier. Dr. Briana Jegier is a healthcare professional with over 20 years of experience in public health and health administration. She's a professor and program chair at Baptist Health Science University, where she leads efforts to educate future healthcare leaders and expand community health worker programs. She has played a pivotal role in developing health administration and public health curricula, fostering partnerships, and securing National Institute of Health (NIH) funding for research initiatives. Previously, Dr. Briana Jegier held key roles at institutions such as Rush University Medical Center at the State University of New York, SUNY at Brockport. Additionally, she served as the chair of the American Public Health Association's Breastfeeding Forum from 2015 to 2022, advocating for breastfeeding as a critical public health priority. Her leadership and contributions underscored her dedication to improving healthcare systems and education. Welcome to this interview, Dr. Briana Jegier. We are indeed honored to have you with us today.
Thank you so much. The honor's all mine.
Dr. Jegier, during your time as chair of the Breastfeeding Forum at APHA, what were some of the significant accomplishments or initiatives you advocated for?
Sure. So during my time as chair, we put in a couple of key things. The first one was an award system that recognized both student and professionals for outstanding work in breastfeeding and lactation. So each year we have a best abstract for students and for professionals. We also developed a partnership with the International Society for Research in Human Milk and Lactation. That was a partnership between APHA and ISHMAL to allow for us to share benefits and science across the two organizations. And lastly, we put into place the forum's first ever set of bylaws, which would allow the forum to continue beyond its initial 7-year period that APHA had granted.
Congratulations on those achievements. Now, can you describe your current role as the program chair of health administration and public health at the Baptist Health Science University? What are the most exciting initiatives you are working on?
Sure. So I think the most exciting things that I get to do on a day-to-day basis is work with our students and our community outreach initiatives. So in addition to being chair, I'm the co-chair of our Health Corps program, which is an initiative to open health career pathways to students from middle school through college. And in that initiative, we bring students to our campus as well as to other campuses in order to meet health professionals, learn what they do, engage in interactive activities to practice some of the skills that they might do as a health professional. In fact, we built a radiation box out of bread box and LED laser pointers to allow students to try out radiation therapy in a safe way that is appropriate for those in a middle school classroom. So that's probably the thing that I'm most excited about, is that ability to really work and bring our disciplines to those young people and to help them connect with programs they might want to go to, mentors, as well as academic support to support them in their academic endeavors.
You have published several peer-reviewed papers and contributed to book chapters. What are the areas of research that you are currently most passionate about?
Sure. So I'm always passionate about lactation research, particularly the research related to lactation and breastfeeding economics. it's an area that's really understudied and undervalued in the field of economics, where we often, take things that are traditionally seen as the role of mothers or women, and we don't put them into things like our national accounts, our GDP. So working with colleagues from across the globe, we've really started to build calculators that you can use for free that show if we just invested in families at the very beginning, what that would mean in terms of cost savings for the health system, as well as cases of disease, both in the United States and abroad. Our most recent paper was just published in August, and actually is a scoping review that really lays out what the current state of the science is and where we can work together better across health economics, epidemiology, and other professions to bring that field forward and really understand why, investing in human milk as a first food is the right thing for all of us.
And following on what you just described, what challenges did you face in advocating for breastfeeding within diverse communities? And how the Breastfeeding Forum at the American Public Health Association tackled those challenges?
Sure. So I think one of the challenges that we face in advocating for breastfeeding in diverse communities is this persistent belief that those communities don't breastfeed. Historically and in other ways, there have been barriers and challenges to all communities breastfeeding, but particularly those from underrepresented minorities, those who are lower income or live in rural areas. And what we have done in the Breastfeeding Forum is ensure that APHA policy is updated with the most up-to-date science and connects why breastfeeding is so important and how effort should be tailored to those populations, especially that have not been given that opportunity or have been systematically denied that right. It really hasn't, we have a lot of folks that are really excited about that. So it hasn't been a challenge to bring it forward, but we continue to work with our state affiliates, our local providers, and others to really bring the support that's necessary to reality. That's probably the biggest challenge, is undoing practices that have lasted a long time. But now that we know better, we definitely need to do better.
As an educator, what future directions do you see for public health education in the next 5 to 10 years?
Sure. So I think, public health education has grown immensely. The areas of informatics and big data in particular have really taken off because we now wear every day bio devices that measure things. We track ourselves, and it gives us a real opportunity for understanding human health in new and diverse ways. I think that'll be an area where we increasingly need individuals with access. I think the other area that will continue to grow is in certificates and micro-credentials that allow individuals who maybe didn't start in public health to come into the public health arena, because we know that health is in all spaces and we need everyone from our teachers and our service professionals to our doctors and our other health professionals to really incorporate the tenets of public health into their work so that we can reach the healthiest nation in a generation.
Dr. Briana Jegier, thank you so much for taking the time to share your insight during this interview. Your experiences and contributions to healthcare administration, public health, and education are truly inspiring. We wish you all the best in your upcoming endeavors. Thank you very much.
Thank you so much.